Hi, my name is Luis, and I'm going to be talking about healthcare in the U.S. Currently, in the U.S., being a middle or lower class and uninsured is becoming a common thing. 8 out of 10 people living in working families are uninsured, and the only healthcare providers for these uninsured families are community clinics, the ER, and many are now going across borders in order to get affordable healthcare. My first supporting claim is that a private healthcare system is increasing the number of the uninsured. My second supporting claim is that with the universal healthcare system, affordability will no longer be an issue because it will be free. My first supporting claim is that the private healthcare system is causing an increase in the uninsured. With the 2001 recession and the events of 9/11, Families USA estimated that in 2001, 2.2 million people lost their coverage due to the increase in unemployment. Also, as insurance premiums rise and more employers drop their coverage, an increasing number of Americans are living without health insurance. According to Families USA, 90 million people, more than 1 in 3 non-elderly Americans, went without health coverage all or part of 2006 and 2007. And 4 out of 5 individuals were in working families, so this is not just affecting lower class unemployed people. The Kaiser Commission on Medicaid and the Uninsured came out with a report in May 2002 entitled Sicker and Poor, The Consequences of Being Uninsured. The report documents how being uninsured does matter. Through extensive literature research, they show that the uninsured have a 10 to 15% higher mortality rate and earn 10 to 30% less because of their poor health coverage. Many people believe that everyone has access to healthcare because they can always go to the ER. However, going to the ER is only contributing to the problem. In the following, I will explain why attending the ER when one is uninsured is contributing to the problem. When people attend the ER, they are not able to have routine checkups, so they can't detect problems early. And this can lead to being in more debt because of the high prices of all the tests that they run in the ER. USA Today published a front-page story about how the ER in the U.S. is falling apart under the strain of too many patients. And one of the reasons there are too many patients in the ER is because so many people are attending who don't actually have emergencies, which is the main purpose of the ER. Consider a person with a urinary tract infection or bronchitis. Going to the ER results in a 2 to 3 hour wait and a big bill for over $500, when if they had a primary health provider, it would have been under an hour wait and maybe $80 bill. Also, an ER physician usually does not have a record of the patient. They don't know them, so they have to practice defensive medicine, which means they have to run a lot of tests in order to find out exactly what's wrong with the person. This, again, leads to a big bill. And they're also given, the patient is given a lot of sample pills, and only to find out that they can't afford to buy the medicine. This leads me to another reason as to why healthcare is so expensive, and it's because of the high price of medicine in the U.S. Because drug prices being much higher in the U.S. than any other country, they're around 60% higher than in Canada or in the U.K. One of the reasons, according to our U.S. pharmaceutical industry, that medicine is so expensive in the U.S. is because they carry the burden of doing research and development, R&D, for the rest of the world, which is, you can argue that because in European countries, if you grab all European countries and put them together, they put out just as much new medicine as we do here in the U.S. Also, here in the U.S., the pharmaceutical industry gets a huge taxpayer subsidies from government-supported drug research done by our National Institutes of Health and by our American universities. My second supporting claim is that with a universal healthcare system, affordability will no longer be an issue. People will not need to depend on an employer-subsidized program in order to have access to proper healthcare. According to the Center of Studying Health System Change, the percentage of Americans in families with problems paying medical bills increased from 15.1% in 2003 to 19.4% in 2007. This translates to more than 57 million Americans of all ages and families in 2007 that reported having trouble paying medical bills in the past 12 months, which is about 14 million people since, an increase of 14 million people since 2003. And finally, with a universal healthcare system, all citizens will have access to proper and free healthcare without any regard to your age, sex, health condition, or income. Thank you.